As more people continue to test positive for COVID-19, health officials say the homeless are among the most vulnerable to contact the virus. We spoke with the executive director of Buncombe County's largest overnight emergency shelter about changes they are making to protect the homeless community.
This is uncharted territory for everybody.
Michael Woods has been preparing for a potential coronavirus outbreak for months.
We've been operating kind of in a red alert type of position for a while.
The executive director of Western Carolina Rescue Ministries says the shelter serves about 1,000 people a week.
We don't know what they've been exposed to, and they may not be symptomatic, but they may be a carrier.
Woods says an outbreak among the homeless community could be catastrophic.
We have a lot of people that have respiratory issues. We have a lot of people who have just not been able to maintain a healthy lifestyle.
He says if an outbreak were to happen, he doesn't have the resources to treat or quarantine the population.
This is a serious public health concern.
At a media briefing Thursday, top Buncombe County officials said they are in communication with hotels and local businesses about the possibility of housing quarantine individuals who are homeless.
We want to make sure that those people who don't have resources and a place to isolate and quarantine will provide that for them.
In the meantime, Woods is taking measures to prevent an outbreak at his facility.
We can put it and just do that and real instantly check someone's temperature.
Looking for COVID-19 symptoms at the door and restricting access to the building. Starting Monday, the shelter's clothing closet and showers will be closed off to the public and meals will be served outside.
We've planned to set up how we would be able to give people bag lunches and dinners and everything who do not stay here. And we want to make sure we keep people safe.
Natural disasters, from hurricanes to tornadoes to flash floods. In trying times, we're socially wired to reach out to help.
We want to nurture people, we want to hug people, but we're not supposed to touch them. We have to stay, 6 feet away? I mean, how far apart are we?
Dr. Craig Martin is a psychiatrist and chief medical officer at VIA Health in Asheville.
So I think what people are going to have to practice is other ways they can help build and maintain human connections, even though they're hunkering down.
Hunkering down because of COVID-19, a virus that has more people facing the possibility they could be homebound for an uncertain amount of time. Working around that will be relatively simple for some. FaceTime, Skype, email, texting.
Some through use of technology, some through just kind of picking up the phone, which is an old technology that some of us senior citizens like me still continue to use.
Major change will almost certainly affect families.
Schools close. You may have children home more. If businesses are closing for a while, there may be more compact family interactions than people are used to, and that can raise stress.
Dr. Martin says coronavirus concern has already come into play at VIA Health.
I talked to one parent earlier today who was concerned his grown children would not take care of themselves, so he ordered something online and had it sent to them so they would make sure that they used hand sanitizer.
Dr. Martin believes being ready is good, but that being mindful in the moment is better.
What people can do right now is to take care of themselves, follow the good scientific advice, and try to prepare their families for what's to come. It's not just about buying toilet paper, it's about taking care of one another.
People are being told it's best to avoid large crowds where folks are gathered in a small room.
Because of that, places like the Western North Carolina Nature Center are seeing an increase in visitors. Employees there say attendance has been up over the last couple of days because they believe people want to spend more time outdoors in the fresh air. But the center is also taking a number of precautions to keep its animals safe.
But one of the things we're really trying to do is prevent our animals from potentially getting sick. Because there are cases of dogs that have been infected. They don't necessarily show the same symptoms that people do, but they can carry the virus.
The Nature Center has temporarily stopped its behind-the-scenes tour. Also, the public is not allowed to touch the animals during those programs.
Coronavirus concerns are adding weight to many businesses.
With the outbreak, the All About Fitness gym in Waynesville says fewer members are coming in. Owner Steve Speed says sweat alone doesn't transfer COVID-19. He says coming to work out is a minimum risk, especially with the stepped-up cleaning procedures in place.
We have sanitation wipes, and we require all of our members to wipe equipment off. I have the employees go around about every 15 minutes and use Lysol wipes.
Speed says the floors are also routinely mopped and door handles wiped down. He says While cleaning supplies are running low at local stores, he says his supply is in good shape since he orders from an online company. He says he has no plans to close and expects to endure the slowdown.